So the kidney, we have the superior pole, the inferior pole, the lateral border, and the medial borders. This area here is called the hilum. And you can see your stellate veins through the capsule. This is the renal vein, the renal artery. The renal artery separates into the posterior branch and its anterior branch. Internally, the renal artery separates into 4 segmental arteries, namely the superior segmental artery, the anterior superior, the anterior inferior, and the inferior segmental artery. And this is the posterior branch of the renal artery. The renal veins follow the same naming scheme and the same routes. Internally, the kidney is divided into the cortex, lying underneath the capsule, and the renal medulla. Within the renal medulla are the renal pyramids. Their bases are directed externally, while their apices are directed internally. In between the renal pyramids are the renal columns of Burton. The renal pyramids have an apex called the renal papilla, which terminate into the minor calyces. The minor calyces drain into the major calyces, which drain into the renal pelvis, which drain into the ureter. There are theoretically 3 constrictions of the ureter. The first one is where the pelvis meets with the ureter. Where the pelvis meets with the ureter, this is called the uretero-pelvic constriction. And the second is where the ureter crosses the pelvic brim or the bifurcation of the common iliac artery. And third would be where the ureter would enter the bladder obliquely, called the uretero-vesicular junction.
Here we have the bladder. We have the fundus of the bladder. The fundus of the bladder. The left ureteric orifice. The right ureteric orifice. The trigone of the bladder. And we also have the ureteric crest here. The ureteric crest. Here we have the bladder with its median umbilical ligament or the urachus, which attaches to the umbilicus.
Looking for the 12th rib kay costal bone, so you can also find along its groove the subcostal vessels, so the nerves, the artery and veins, so below the fascia here. Followed by another nerve passing diagonally sa posterior abdomen kay ang iliohypogastric. Then this one's the ilioinguinal, so more inferior pa. This one here is the lateral femoral cutaneous nerve. And then this huge nerve bundle here is the femoral nerve. This one. Also important to take note would be the muscles to help give you a landmark. So this is the quadratus lumborum. Then this is the psoas. It is divided to the major and minor, pero the division in our cadaver is not delineated obviously. So clearly or obviously. So this one is the iliacus. So together kay the iliopsoas. Then if you move the common iliac and the psoas muscles apart, inside kay you can find the obturator nerve. This one. Karora?
Yeah.
Obturator nerve. So if you palpate it, kay a good landmark would be the ischial spine. Then the genitofemoral is it's usually along the psoas muscle. So for ours, it's over here. This small one. So with its branches na.
Here we have the spleen. the posterior extremity, the anterior extremity, the superior border, the renal impression, the colic impression, and the gastric impression. We also have the ligament of the spleen, or the splenic ligament, splenorenal ligament, and we have the costal surfaces, the splenic artery, and the splenic vein.